All right, I think we have got a lot of folks that have joined, so we'll go ahead and get started. We are really excited to have you all here today. We're talking a little bit about leadership development in infant and early childhood mental health consultation. So, thinking about all of the types of folks and activities that support the sustainability of consultation and scaling it up and ensuring that the quality is high. Um, I am going to go ahead and pass the baton over to Dr. Neal Horen and Lauren Rabinovitz to introduce themselves, and then I'll introduce myself after they're done. So, Neal, I'm going to go ahead and pass it over to you.
Sure. Thanks, Jen. Welcome, everybody. I'm Neal Horen. I am here at the Thrive Center at Georgetown and direct our early childhood work, as well as oversee our Center of Excellence for Infant and Early Childhood Mental Consultation. And today, joining the other directors of our program, Jen and Lauren. So I'll pass it over to Lauren.
Hi, good afternoon, everyone, or good morning, depending on where you are joining from, or maybe evening. See lots of familiar names in the chat, so really lovely to see you all, and thanks for joining us this afternoon. I am Lauren Rabinowitz, and I have been lucky enough to be part of this program since we began many years ago, and also have done lots of work with mental health consultation over the years, and excited to be here today and pass it back to you, Jen.
Awesome. And I'm Jen Drake-Croft. I work alongside Lauren and Neal as one of the faculty directors for the program. And we have started to make some shifts this year, thinking more about developing this leadership component. So, as we get started, we're gonna walk through why we think that focusing on leadership development in this space is so important. And then at the very end, we will talk a little bit about our certificate program, how it's structured and what the benefits are and that sort of thing. But before we get started with Dr. Horen presenting, we want to go ahead and put in a poll. We want to know who's in the room. So the first thing we want to know is, what is your role? So are you a program or agency leader? Are you a policymaker, funder, or state administrator, an evaluator, a researcher, a consultant, or practitioner that's wanting to learn more about being a leader in this space, or maybe you already are one? And then after you have filled out the poll, in the chat, in one word, we want to know, how is consultation going where you are? So we'll give it just a minute for folks to fill that out. Awesome. We got a lot of program and agency leaders in the room, as well as a lot of consultants. Okay. Oh, and I have some really good one words and even multiple words in the chat here. Some folks are on the struggle bus a little bit, lots of cases coming in, but mostly it's looking like it's positive. That's great. Oh, and I see Portia is on the call. Good to see you, Portia. And Cynthia. Oh my goodness. I'm recognizing people too. This is great. Wonderful. All right, Neal. I think we're good to close the poll now. So you can see as we look at the makeup here, this is a bit what we would have expected. You know, there are not necessarily a ton of evaluators that are in this space. And so we're glad to have a few of you here, as well as some policymakers and funders. And I'm so curious about that other category. So maybe if you answered that you were in the other category, tell us in the chat what profession you hold or what brought you here. All right, Neal, you're on.
All right. Well, good to see a lot of our friends here and excited to get going here. We're going to spend the next half hour or so talking at you, but please throw in the chat. We'll leave time. We'll come back. But this is really a conversation. And those of you who know me, like that most conversations, I just talk a lot until somebody stops me. But I'll start, and then we'll sort of see where we get. as Jen said, we've obviously spent a lot of time doing this work. And what we know is that this field has really come a long way. And I've been doing this work for quite some time, and we have real measurable results. We know that there's reduction in expulsion. We know that the outcome data that many of you have been involved in gathering, we see the positive benefits of mental health consultation. We have a growing workforce. Many of you know that I'm pushing to really expand that workforce as much as possible. You see some of our early work here that Kathy Hepburn led for our center here at Georgetown about some of the outcome data we were finding. And we know that investment that's been made, and many of you are the leaders in your communities. I saw Stephen and Brandy, and I saw Anna I see a lot of folks who are instrumental in getting us to where we're at. We have good data about the effectiveness of mental health consultation. We know that there's a good, strong, burgeoning workforce. Lauren Rabinovitz and our team at Georgetown led recently a national scan. Our best guess, and it is a guess, and you'll hear a little bit about that, but our best guess is there's probably about 5,000 mental health consultants in some way, shape, or form. Whether we all agree that they should call themselves that, whether they have reached some level of competency is a conversation that many of you as leaders are having and have tried to address. But we know that there's at least a burgeoning workforce and an evidence base behind it. That's really important, and we know that can be really helpful. It's not a replacement. We don't think either you do workforce development or you do leadership. So financially, some of you may be being forced to make those kinds of decisions. We see them as equal parts of building the system that supports children, families, and staff. The challenge is that it still sort of stalls, stays small, or disappears. And that's the real challenge. And I've seen this. If I were to be honest with you, the first program I really knew about that was mental health consultation was in Cleveland, Ohio. It was an amazing program. And then they were at about the same time starting work in Michigan, and there were small pockets of work happening. This is a long time ago. I had a lot of hair. It was parted in the middle and feathered back. What I've also seen though is that those programs sort of contract and expand, as many of you have experienced. And it's really important to keep that in mind, that in terms of these sort of outcomes that we have, the workforce that's been built, it's still not enough to make it necessarily stick. And it does, it sticks. I know that you are saying to yourself, yeah, it sticks. Where I work, it's working. We're aware. I'm saying in a global sense. And you can see from some of the work that we've been doing in our scan and some of our outreach to hundreds and hundreds of folks around the country, folks who work in Head Start, and I know that's a touchy subject right now. We can spend another webinar talking about that, but $2,000 to fly somewhere, stay for 2 days, and maybe you can send a few of your people in Head Start. You have a training budget for folks that's $10,000 total. You have, the efforts around endorsement. All of these are good things. I'm not saying that they're not good things. Training people, supporting them, continuing professional development are all good things. But they're not consultant problems. There's a systems sort of piece to all of this that I know many of you could sort of speak to much more eloquently than we can. We're just aware of sort of how it is everywhere, not just in the one place in which you're trying to figure it out. So these outcomes, this workforce, the competencies, all the work that all of us as the field have done are critical, and we got to keep pushing. And all of these are systems and leadership issues that we think deserve support. I was talking to Joan Lombardi a while back. Many of you may know Joan was one of our great federal leaders in the early childhood field. And she said that one of the loneliest jobs to have is to be a leader in early childhood, that you're always trying to figure out the next thing, and you're trying to figure out funding, and you're super excited about the workforce that you've built, but you know you need more. And I always put that question forth. If anybody here feels like they're done, we are good to go, we have everything we need, we're never worried about funding, I'd love to hear it. And I think that that's the challenge of systems building, is that there's always room to continue to grow, to expand, to figure out how we continue to serve as many children, families, and staff as we can. And I'm not just talking about early care and education. I'm talking about, from the broadest of perspectives, how do we have mental health consultants who are supporting folks in primary care and early intervention and home visiting, in child welfare, all of the spaces in which children and families find themselves. And so, again, there's continued room for folks to grow, and particularly as a systems leader, we know that there's support that would be helpful. What surrounds this work hasn't necessarily kept pace. And I'll start with this first one, and it's one that we continue to talk about. And there are great thinkers on this call, in this field. I know there's a great meeting that happened last week among some of the leaders in this field. I would say that we have some definitional challenges for us. There is not a license to be a mental health consultant. It means that a state doesn't necessarily completely control. And the truth is if somebody says, I'm a mental health consultant, I don't think I can stop you from saying it. I mean, I can't really stop anybody from doing anything, just by trying, at least in my house, but anybody can sort of claim title. And it is worrisome. We have a set of competencies. We've crosswalked them with the endorsements. We know that states think about this, and communities and tribal nations really think about what it is. But I don't know that I would say we have a shared national standard, a shared definition. And we have a set of competencies, but that is a challenge. That's a structural gap. None of these can just be solved by training a consultant, but that's one challenge for us. We know that not every state has figured out a way to just magically bill Medicaid and everything's figured out. And even in places where some Medicaid is involved, it still leaves folks to try and braid grants that expire, try and rebuild financing every few years. Again, I know that there are folks, I see you and I know who you are, that have been much more successful on the long term around financing. There are way more that haven't, that continue to try and do this year after year, figuring out how do we get money. General revenue dollars that Marla Heminger used in Ohio 30 years ago are not what they're doing in Ohio right now. And bless Marla and other folks who were very early in this field, but things continue to shift. People always ask about Medicaid. How can we do it? I'm not sure that it's the only answer, but I think that this is another example of something that hasn't kept pace. We have talked to hundreds and hundreds and hundreds of consultants, and they continue to say that folks don't understand what they do. Are you doing the pyramid model? Again, all props to the pyramid model, love it. Are you doing discipline? No, I'm a mental health consultant. 3 in 4 report that the programs they serve don't actually fully understand it. That's a scary statistic. It means that most of the time the mental health consultant is trying to do their best to do what they've been trained to do, what they're expected to do, and the other person who they're consulting with doesn't understand it. And in a country with 74 million children, our best estimate is about 5,000. Let's even say, like I usually am with math, way off. How about 10,000? That's still 10,000 people for 74 million children. Point of all this is to understand that these standards and the financing and all of these things are our leadership opportunities. They're designed, they're funded. You all as leaders are trying to address these. Again, many of you successfully. Some of you are here because you're trying to figure it out, and that's what we want to help with. And I really want to push that for folks to be thinking about this as a way that somebody in charge doesn't necessarily mean that they're completely in charge. Doesn't mean that you control all financial aspects of your early childhood system. It doesn't mean that you control all aspects of training, licensing. All the different things when we think about mental health consultation require an amazing amount of tuning like an orchestra. And good leaders have not only those skills, have figured out ways to do that, but they also understand the importance of having support and trying to figure some of those out. Again, Jen, if there, or Lauren, and I know Julie and Kelly are on too, if there are questions that come up, you just jump in and let me know. I'm just going to keep going. It's not a criticism of the field, right? This started as this indirect approach. We can talk about Kaplan and other good work. We know that the folks like Khadijah Johnston and Mary McCrane and Liz Bissio, and I'm going to leave folks out, so I apologize, but I think the Allisons and other folks who were really the pioneers in this field, and then Deb Perry and Mary Dallas and folks who were doing the research on this, we started to build that evidence up in the early 2000s. We started to really think about competencies as the federal government, SAMHSA in particular, ACF, HRSA, really started to help support building competencies and training programs. And where we are now is thinking about how do we build this leadership layer. Every layer before took deliberate investment. SAMHSA invested a lot of money, not just in things like national centers, but in all the grantee programs that they funded, like Project Launch, the infant and early childhood mental health work, how ACF has funded work in Head Start and in childcare. Every single piece of this, the evidence base, everything, is deliberate investment, and they didn't sort of just happen. It was because of leaders in the field continuing to push. This is not a criticism. It's a description of each sequence in order of where we've gotten to, which is the need for this leadership layer. And that's the last card that we're sort of living in right now. And so I really want to spend a little bit of time talking about that. We see it as two halves of the same solution. And I have spent a fair amount of time, particularly recently, really trying to figure out this workforce. Again, I'd like to be off by a factor of 50. I wish there was 200,000 mental health consultants, because I think that's where the need is. I speak to folks in not only in early care and education, but in the child welfare system, in the early intervention system, in home visiting. I know that they benefit when we're make available mental health consultants. We have this workforce that we've been developing, the people who are trained in reflective practice, grounded in child development, who know infant mental health, who know consultation, who know the arena in which they're providing that service. That's one half. We got to keep investing in it. And we have to start to invest in the underinvested, this next layer. All of you, the people who build that system, who think about their program, who go on to the COE website and take the PPRT that we put so much work into around how do you actually know all the elements of your system, of your program? How do you know what to do? How do you build a manualized approach in some way, shape, or form? How do you integrate that with all the other efforts that are going on, like QRIS, coaching and pyramid model, use of conscious discipline? And I'm just mentioning, I'm not trying to be exclusive. I think there's a number of good things. And then most importantly, how do you build in that evaluation and prove that it works so that you can get the next layer of investment? Neither of these work in silos. A skilled consultant in a system that can't fund it isn't going to work out. And so, I think that a lot of this is really about, are you pulling from the workforce? Like, we can't do either or. We have to invest in building our workforce, and we have to invest in building up the leaders who are going to help ensure that that gets sustained. I feel like I'm really passionate, Jen. I'm right. Yeah. I put on my passionate glasses. All right, so let's sort of talk about, we say, who does this? I mean, I've been doing mental health consultation for a long time. I didn't get trained on it. Somebody at Georgetown said, you're going to be a mental health consultant. I was like, okay, do I get a shirt? Does it have my name on it? Like, I don't know what it is. And then they just put me in a Head Start. And I learned with some great mentorship from folks at Georgetown and in the community in DC, families, children, the staff who helped me sort of develop it. But we have this folks with deep clinical expertise and like no preparation for the leadership role. Many of our leaders were folks who were like, I was a mental health consultant. Okay, how'd you become in charge? Did they train you? Nope. Somebody left and I applied for the position. Right? So here we start. 59% of folks were hired into their agency as a clinician, right? Almost 2/3. I don't like to do math in public, but I think that's close. Then they got promoted because you're good, or you stay a long time. That's how I got promoted. I just outlasted everybody, but many of you stay and you're good and you feel prepared, 23%, which means that 70-something% don't feel prepared. And then you learn on the job. You get some sort of mentorship, is generally how people say that they learn to be the leader, and then you feel very unsupported. That is not a way in which to say that's who's going to help our system be successful, right? We talk about, I got to say this, like, you'll be all right. I'm sure you'll be all right. There's 21 minutes of missed time with me is like an hour of free time. But I think that part of this is, I don't know how many of you were trained on financing of systems, administration, Medicaid. I think I got like maybe an hour in my training, my clinical training on any of those things, right? So then we're asked to know what to do. How do we go? I was on a call yesterday with an early childhood leader who was talking to somebody at state level and essentially saying, we need some money. And I was fascinated by the sort of pitch that they were making, because it takes a lot to sort through, like, how do I make the pitch? What am I asking for? How do I understand how all this money flows and things like that? We don't get trained on any of that. And I think that the research that we've done suggests that leaders arrive uniquely unprepared for the leadership position that they get put into, right? Now, there's a small sample that this is talking about, very small, it's one state. But the truth, yeah, so I like, Natalie, what you're saying there, right, is get creative. To me, get creative is great if I've been giving a set of paints and a piece of paper. I'll be creative, I can paint some things. Get creative on money that doesn't belong to you, to build a workforce that you don't have the capacity to find, to serve places that no one's gonna pay for us to go to in some remote part of, frontier America, is not being creative. It's being handed a task that is somewhat insurmountable. Yeah, right. And Lauren, I love this point. Like, we get self, that doesn't seem to me, it's great. And we actually have, I would argue, I could think of 20 or 30 people off the top of my head who are incredible leaders that I assume didn't get trained, but they read Khadijah's books, or they came to Georgetown stuff, or they learned it in Head Start, or they worked with Sherry Heller or Allison, but the truth is that we should be a little bit more deliberate about how we go about this. That we should think about, how are we training leaders? We've thought about it. That's why we have this certificate, and whether you like the certificate or not, whether you take it or not, there are a couple people here who have taken it. There are a couple people here teaching the course. Our point is somewhat about this, but more importantly about how do we all as a field continue to advocate that this is not the half we just forget about, that we just keep working on the workforce. We do work on the workforce, and we have to do this. I like levers that move other levers because I didn't do well in physics, and that's the only thing that I actually learned was about levers. I actually don't know anything about levers, but we know that leadership is what makes this role. Not just the leader, but leadership. And I've seen this in places where there is a particular person who has done great work, and I've also seen it where that person is also very clear that they're connected to all the other folks who help that really happen, right? So lever one is this leadership policy advocacy. I love telling the story about in Maryland where Deb Perry from Georgetown did a very tiny pilot. I think we got, I'm just going to say $25,000. It may have been a little bit more, but it wasn't a lot. Did a small study with these pilot sites and then took that data and families who have been impacted, whose children had not been expelled or suspended, and they worked in the legislature to help secure funding for mental health consultation in Maryland. That's an oversimplification of the story, but the truth was it was a combination of leadership, advocacy, and policy coordination that really Maryland was a great example of a state where lots of people were on the same page and continue to be, because of folks at a state level. But that lever is really important. It keeps our agenda on the table, and I say our agenda as a field. Then we start to think about funding, which is so complex, and because it's not one federal funding stream like some things in our early childhood systems, it's complicated. So that's another lever. And then we have all of this data and evidence that can help make the case. But somebody has to do that. Somebody has to think about, how do you braid funding? How do you build a data system? Boy, if I could sort of just lay out end to end how many people I've talked to across the country about we need a coordinated data system, and how many of them are like, we can't do it. Not that they don't exist, but they're very challenging. These are leadership acts, and you can't do them without some support. And I just think that there's lots of good work that's happening, and it is important, but none of these move by themselves, right? They are levers that have to be continuously watched and manipulated. I love the comments, Bernadette, right? Somebody needs to know, but also you need to know, so what is Head Start doing? What is Care doing? What is home visiting doing? In Colorado at one point, Title IV-E, which are child welfare training dollars, were actually able to be accessed for mental health consultation. Why? Because everybody's talking to each other, and leaders were thinking about the different levers that they had to keep these things moving. So I think that these are the kinds of things that we hope that you'll think about. And if you feel like I've got it completely under control, share. If you're like, no, this is speaking to me, like I need help, we have potential support that we'd love to talk to you about. Okay. We sometimes actually forget why we do this work. We are in the midst, as some of you may know, we have a huge workforce effort going on around training more mental health consultants. We are emphasizing to the nth degree how important relationships are in changing outcomes, and how important reflective practice is. And in infant and early childhood mental health consultation, that is standard practice. I hope that all of you are either providing it, accessing it, ensuring that your mental health consultants are getting it. I saw that in the poll, some of you are mental health consultants. You should be demanding it. We know that this is something that gets funded in program budgets. It's treated as sort of everybody has to have it. And then what happens when you become a leader? No one is providing it to you. Or you don't feel like you get it enough. It's the first thing to go. Half of the folks in leadership positions go find it on their own, right? So we sort of stop applying principle that we think is so critical for everybody else. We don't do it for ourselves as leaders. And the same values that shape how we support practitioners, we should be using the same values wherever you sit in that system. If you are the director of the infant early childhood mental health consultation program, you should have access to the same kinds of supports as your mental health consultants. And your mental health consultants, if we say that everything's a parallel process, that the mental health consultant in working with that other adult is providing something, we keep going all the way up to the top. And I think that this is part of where we sort of get lost a little bit. We sort of forget, why are we so focused on the workforce? We should be, because we want the workforce to get us to those outcomes, and we want to support them. We have to do the same for leaders. We have to continue to think about leaders as just another part of that system, not some separate part that we don't pay attention to. Yeah. So I think I saw a comment in here go by, yep, paying out of pocket for reflective supervision, right? So to me, it's just another example of why do we tell everybody, it's sort of physician heal thyself. It's this whole idea of we tell everybody you should have reflective supervision. Our leaders get it, but they don't feel very supported in their own reflective needs, right? You got it when you were doing this, but you don't get it anymore. Okay, this is not a set of competencies per se, but this is what we keep hearing is missing. Dosage, staff, all the things in designing the service model. I didn't get trained on that. We figured this out as we move along. We have to sort of integrate things and not see them as all separate and, oh yeah, we do QI stuff. We should talk, like, this should all be one thing. How are we supporting our early childhood system? What do systems leaders need to do this well? How do we build those organizational capacities? Sorry, one second. Just moving along, I'm trying to find my space. Thanks. How do we do this in a way that sort of builds those organizational conditions that you can be the most effective leader? I've seen this at every level. I've seen leaders after disasters, many of you have heard me talk about this, that the first thing they do is they stop taking care of themselves and they only worry about other people. How do we build the conditions so that you all are just as taken care of as you try to do for your folks? How do we finance beyond a grant cycle? How do we really, and again, there are folks on this call who can tell you how they have done it. How do we help leaders do that? How do we help them really get the evaluation that they need to prove that impact so that they can go into a conversation with data that is a marketing tool, not just a piece of paper with numbers on it? And how do we make sure that they're leading for equity? How do we make sure? I was just on a call with folks in a state where I said, we did at the Center of Excellence, we did like a reverse TA. We went and tried to find people who might benefit from TA, who might benefit from something because they don't even know they didn't know that they could access things. And the people who could tended to get in there. How do we lead for equity at a systems level? How do we ensure that access is for everyone, not just where sort of the budget money sits, or that the big county in your state that get things, or the big city, or the tribal nation that has access to more dollars is the one that is reaching certain people? How do we do this in a way that we really address equity? If we really think that that's what this is about, which I think we agree, mental health consultation is about addressing equity. If there's somebody on from Alabama, you are more than welcome to just go off on us for what we have here, but I think we're close, so give us a little grace. But here's one way in which, from a leadership perspective, folks went about this, right? So they had a federally funded grant, not unusual. I think almost everybody here has been in some way part of a grant. And, you know, that's great. Grants are great. And so they placed some mental health consultants in one of the counties in the EI program. Fantastic. Going into it, knowing that that grant is going to be 5 years means that after 5 years, you're going to have to figure something out. And so for the 5 years, that mental health that early childhood mental health coordinator role is created so that there's a sustainability piece to this. It sits at a state department and it's jointly funded. And that means that then other people really start to think about that it's not just one agency's work, it's our work. Again, I've seen this in many states. Maryland's a great example, but there's 4 or 5 other states in which folks see anything that's addressing the needs of young children as everyone's responsibility, not one agency. So home visiting is, yes, it's under the purview of somebody, but it doesn't mean it doesn't mean something to us. This third card here is really the key. The grant ends, and now we have 10 consultant positions created for licensed childcare. The state keeps funding it. Why? Because during those 5 years, there's a way in which we actually sort of understand how this could be sustained. 10 more positions the next year, and a service coordinator, and a reflective practice coordinator. I think somewhere in here, I was in Alabama, Dallas and folks invited me there to see firsthand sort of the great work that was happening there. And moving forward, statewide mental health consultation and early intervention starts as a pilot and now offered across the state. Many examples. Dr. Nikki Edge in Arkansas and the work that they've done. Great examples of, we're going to do this in child welfare, this is how it's going to work. This grant ended in 2019, but the leaders have built roles and funding that weren't about that grant. It was about what they wanted to do. That's what systems leadership is really about. And I think it's a great example, just one. And there are, again, there's 100 of you on here. And I think there's 100, well, there's a bunch of you from North Carolina, so you only get one story. But there's a lot of different stories state by state in terms of, you know, the kinds of things that have been built in those places. Oh, yeah, so here's another example. It's not just one state. When that leadership in Washington State's another example, again, I'm not trying to insult Washington, D.C., or Navajo Nation, or Cherokee Nation, or Illinois, or Arizona, places that have done amazing work. We're just giving you a couple of examples of where we've seen this leadership sort of really play out. And the differentiator was not a better consultant per se. I'm not sure that I can point to the consultants in Washington or Alabama. They're not better. I know the consultants in many states are fantastic. But what we know is that when we, you know, everything before this has been sort of the gap. Here's like Washington. This is a great example. Countywide initiative that makes infant and early childhood mental health the core strategy. Then you start to map that landscape. Then you build a strategic plan. No different, those of you who've had a project launch grant, we have numerous examples of this, but then we start to see how this starts in a county and goes to a, and that connection, that launch was such a great impetus to say we have to have this state, you know, state and local connection, or in tribal nations, it's a little bit different. But it's not about the consultants per se, super important. It's about leaders who organize, fund, and coordinate this work. Illinois is a great example of this. Pennsylvania is a great example of this. States where people, yes, leaders, and we can name them, you know, Brandy Fox in Pennsylvania, or Alison Steyer in Arizona, or other folks, but it's not just that person. It's about the idea that everybody in that state is invested. Tracy Duarte, the Head Start Collab Director in Pennsylvania, is equally invested in mental health consultation as the counterparts in other parts of state government there. Oh, is Brandy? What, Brandy's? Oh, Brandy's right there. There we go. All right, cool. Brandy, if I'm saying something wrong, you're gonna have to jump in there, and then we're just gonna shut the chat down because it'll be too embarrassing. So I want you to think about, when we started sort of, I thought everybody was describing me, Jen, in the chat. Robust, complex, disjointed, but apparently they were talking about their system, but that's fine. But I want you to go back to thinking about your consultation work in your system right now. And if it stopped tomorrow, what would be the reason? I don't think that most of you would be like, our consultants really aren't that good and we just couldn't get any work for them. Maybe it is, but in the chat, if it stopped tomorrow, what would be the reason that consultation stopped in your community, your state, your tribal nation? Funding. I'm sensing a theme. Funding, budget cuts. Budget, leadership turnover, lack of buy-in, meaningful data, buy-in. Oh, Adriana, buy-in, lack of knowledge, funding. Again, thus far, no one's putting in here, The consultants are just, we've got really bad consultants. That's not the issue. The issue is around the leadership pieces that we've been talking about here for 30, 40 minutes. Knowledge, funding, leadership. So with that, I'm going to turn it over to Jen, because I think that this is when that leadership layer is strong, everything ripples outward, right? When we have strong leadership, we know that consultation that's well designed and funded and integrated. We have examples. There are people on this call right now that could tell you how they did it. And there are great examples. And it's even in places, and I see Grace here from Ohio. I think that we have examples of places that have grown, contracted, grown again, shifted their priorities and things like that. So I just think it's important for folks to keep in mind that this is a moment to really sort of think about, what does leadership look like and how supported are we in terms of our leadership?
Thank you so much, Neal. I'm going to go back a slide here. So, yeah, basically all of the slides leading up to this is why we felt like the timing was so important for us to pivot a little bit on our certificate program to ensure that we were supporting this layer. And as we were thinking about its design and enhancing it for the leadership angle, one thing that was central to it that actually Lauren, who's on this call, I'm going to ask her to speak to it here in just a second, is this capstone element that we wanted to ensure that you all had the opportunity to develop something meaningful that was going to get you farther down the road, whether it be in helping the community understand what it is that consultation is, whether it be designing evaluation to get that data that's going to support you in your advocacy and fundraising efforts. Whether it be thinking about your own workforce development, right? We know that under leadership, there's a lot of different activities that are important. And we wanted to make sure that this program supported you and your unique needs so that you were walking away with something that didn't feel generic, but felt like it could take you to the next level. So before I hand it over to Lauren to talk a little bit more about the capstone, I'm just going to talk about the infrastructure of the program itself. So we built this from the get-go to be for working professionals, which means that largely it is asynchronous. We meet from the end of October through mid-June. We have one synchronous lesson a month provided by luminaries in the field. So we already mentioned Brandy Fox, who is on our call, and she talks a lot about the systems design that has gone in place in Pennsylvania, and she continues to build the system to ensure that it is sustainable and ensure that folks are lifting one another up in terms of improving their quality across the board, with an eye to thinking about the rural communities and those communities that often get left behind. We have Dr. Annie Davis Schock, who teaches 2 sessions on evaluation. We have we have Khadijah Johnson, Dr. Sherry Heller, Dr. Evandra Catherine, others that are leading the field in this area that you get to spend 2 hours a month with in what we call a flipped classroom model. So you'll watch their lecture asynchronously, and then you get 2 hours with them to pick their brain on what does this actually look like in practice. And then you get Neal, Lauren, and I as well teaching on some of the nuts and bolts and some of the Georgetown model work. Lauren, I would love to bring you on camera if you feel comfortable to talk a little bit about the capstone and the support that's going to be around that.
Yeah, thanks, Jen. So the capstone component of this program is actually not something that is brand new. We used to do it a number of years ago, and for a lot of reasons, we learned because we do a lot of evaluation of the certificate program. And for the way we were running it, it didn't seem like it was maybe the best fit. But with the way this program is being structured now, we're really excited to bring it back. 'Cause I think it's a really excellent fit for the need of leadership. So it was an idea we were all talking about, but I can now confirm it's going to be successful because I've had the privilege of reviewing applications that have come in thus far. And we asked everybody to give us an idea of what you were thinking about for your capstone. And I mean, I'm a self-professed nerd when it comes to anything that has to do with data or evaluation or systems development or infrastructure building. And I was just sitting here reading these with a big smile on my face because it was genuinely exciting and energizing to read about these great ideas that you all are bringing. So that's kind of your, as a participant in the program, that's what you bring to it. You bring an idea, you bring a need, and our commitment is to help you get there, help you identify what are some of the sticking points in going from point A to B. And we'll have 9 months to work together. I think that the team that Jen just described represents an enormous amount of expertise and just so much varied experience, but we also have connections to other folks. So that is our commitment, is to help give you what you need. And I think our hope is just once it ends, some of these projects are big. They might not be completely done in 9 months, but we really hope that it'll have you be well on your way and that you'll share lessons learned with the broader field. Since we started the Center of Excellence so many years ago, our goal has always been to advance the field, and I think this is just one more way we're trying to do it. So
Yeah.
happy to answer.
And I can attest to her nerdiness because we got a text on the weekend. She was reading these on the weekend and being like, "Wow, this is awesome." So the other thing that we try to bring to this program is this connection to the work that's happening nationally and sometimes even internationally. So all the stories that Neal is able to sort of pull out of his pocket, like Lawrence, same thing, Julia Kelly, same thing. It's like you've got this group of folks that we've been learning alongside other communities. And we really see ourselves as people who want to not be gatekeepers. We want to share the latest and greatest and the innovative work that's happening, and we want to connect people with one another. And so, as a part of the certificate program, we do have a large alumni network of about 300, maybe 320, where we have like an asynchronous base camp where people are able to ask questions like, "Hey, I'm struggling with this," or "How are you handling this?" or "Hey, I need to hire somebody. Does anybody in this area, in Southern California, know anybody who would be a good fit?" All of that kind of stuff. So that's just a little bit about the program. We're going to go ahead and pivot a little bit to your questions, though. So we've got some here just in case nobody had any questions to generate conversation. But I actually want to open the floor right now and ask you all. Does anybody want to me, I should have asked, can folks come off mute or do they need to put their question in the chat? Okay, I think they can come off mute. So if you want to come off mute or put your question in the chat, we're here. We'd love to answer them in the next 10 minutes we got together. Oh, there's a good one in the Q&A. I can't see it, Julia. Can you tell us what it is?
Sure. I think this is a great question. It says, where do you think consultation should live or is best sustained? Within state departments, within community mental health centers, within early childhood councils? We see a variety in Colorado, and I think each has unique benefits and challenges.
I always have an answer, but Neal, you got an answer you want to lead with? It is a good question, Lauren.
I like that you both love the question and have answers, but you're going to make me go first. Perfect. Yeah, my first answer is any of those places. I just wanted to live somewhere. And I think that in a more serious way, I think the places that have thought this through. So, for example, I live in Florida. We were just talking about the early learning councils here in Florida as places. In Maryland, there's a different structure. So it also depends on the structure of a state, the way communities, like some places, it's very community or township driven. In other places, it's very state down. And so I like to think about there's not a one size fits all, but there's also a sense of is everybody working towards this? Meaning, if the state is trying to figure out how are we going to support this? How are leaders at the state going to support this? Then at the local level, how are we implementing it? And I think that that's what I've seen are good examples of places where they've thought this through a little bit and how things work. So Colorado's a great example of when they started doing, they started at some point putting an early childhood person at every community mental health agency. That there's some thought that has to go into it. So I don't think it's a great um, a great answer of I think this. I think that we have examples of lots of different ways in which it sits at a mental health agency, they administer. It sits at the state, they administer. So I can't wait to see if I got it right based on what Lauren and Jen say.
I give your score 100. No,
Ooh.
I completely agree.
Fantastic.
I think that every system, every state, every community is different and have different champions and even different ways that they're funding and structured. And so it's sort of like go where there's the will and the understanding and the likelihood that you've got the champions that are going to help create those conditions that are going to allow it to scale. But yeah, you can't look at any state and have uh, like there's just every state's early childhood system looks different. So yeah, go with what works, and then just be willing. Also, I think what we've learned in the last, especially 10 years, is a willingness to relocate and adapt if needed, you know? So if it's with the state, for example, and you're trying to enhance equity and you're unable to do that through the state system, then maybe it does belong in a privately funded, nonprofit or something like that, right? So how do we keep the why in mind about what it is that we're trying to do, and get less maybe attached to the who holds it and more attached to the um, are the entities that are holding it the best ones to hold it for the why that's behind the work. Yeah, Terry, I see your hand raised, and I think that means that Sumia can take you off mute. I don't know.
Okay.
Okay, perfect.
All right. My question, well, it's not really a question. There is a need. I mean, I've been working with with the same consultant for the last 10 years with the Tribal McVie grant. And I see that there is a great need um among the tribes. I mean, on reservation and off reservation. And I think about, like I live here in Rapid City, and it's like we have a Oyate Health Center here. So I could see it being housed there, but I'm currently the program manager of the Tribal Make Free program, and I'm trying to work it in both in a reservation and in this town. And I would just, I guess it's more just of a statement, just saying how much this need is in tribal lands, in tribal communities. And that's why I'm interested in thinking about applying for the certificate program.
Yeah. Thank you, Terry. I appreciate that.
Yeah, Terry, there are good examples. I think that there's, again, within a tribal nation, how that government determines how they would best want to support things, right? How does money get allocated? But also there's there's great examples across the country of tribal nations that have done some amazing work, oftentimes starting from some grant funding, like a project launch grant or things like that. And there's, as you know, there's great variety amongst the hundreds and hundreds of federally recognized tribes, ranging from really sophisticated work the Cherokee Nation did in terms of using their epidemiologist and really thinking through how to do these, to much smaller tribal nations making some tremendous strides through the work that they did in their Head Start, where in their tribal Head Start and things. I love that you're feeling encouraged, like we've got to do something, which I think is a great starting point. I think I saw a question in there about how much experience. The truth is, again, no one can tell you you have to have experience. I mean, it obviously helps a little bit to have some experience, uh, but we're also happy to help. I mean, that's the other thing, is the Center of Excellence is also, we have a lot of resources. Many of our friends here can attest that we try to put as much free information out as possible. So if you're trying to think about these things, we're happy to help.
And if I could just add one thing that I think sort of speaks to both what Terry had asked about and Natalie was asking about. I think they're great questions and wonderings that have a really good tie to this particular certificate program, and how we want to work with you to think through these really complex questions that we always embody the parallel process to you all are the experts in your communities, in the service arrays that are already being provided, what the workforce needs are, and we want to help you make decisions, very informed decisions. And so part of how we do that is by asking lots of questions. And have you talked to this state partner, or if you are connected to this tribal leader, and et cetera, et cetera. So really appreciate those questions, because I think that they well represent what this certificate is prepared to support you all on.
All right. Well, we are 1 minute to the hour, and I know that lots of people have to hop right at the hour, but I want to thank you so much for taking the time to be with us here today, for asking such thoughtful questions and being so engaging in the chat. That is really rewarding when you're presenting to anybody, right? To have that kind of energy. So I think that Sumia put the certificate program in the chat. If anybody wants to apply for it, we also will have the recording distributed to everybody who registered. And we will have it on our Thrive Center Vimeo and YouTube pages. Neal, Lauren, any last words? Okay. All right. Well, we will end. Have a great rest of your day.